The subjective experience of trauma is unique, and it varies according to the individual and the type of trauma. What doesn't vary is the fact that the trauma often results in a devastating intrusion into a wished-for life of peace, calm and well-being, along with a corresponding unexpected and undesired fragmented sense of self and life in general. Dr. Roland McCarthy, PhD. Trauma can be anything that violates your boundaries. It can be one event, or it can be many smaller events that build up over time. Many of our initial sensitizing events can happen before the age of 7. But trauma isn't just something that happens to you in the past. It's not just a story or a memory. Emotional trauma can actually change your brain and how you see yourself in the world. This can lead to profoundly disturbing physical sensations and emotions in the present moment. These traumatic events and experiences in both childhood and adulthood can linger inside you, and they can make you feel depressed, anxious and fearful for years. This is commonly known as post-traumatic stress disorder, and it's a heavy burden to carry. We're made to believe that talk therapy and psychiatric drugs are the best way to overcome it, but this is not true. You can overcome psychological and emotional trauma without having to resort to lifelong therapy and medication. This doesn't mean that it's easy. It can take time and effort, but it can be done. Dr. Bessel van der Kolk, MD, a psychiatrist at the Boston University School of Medicine, and one of the world's leading experts on trauma, is convinced talk therapy isn't that effective, and psychiatric drugs don't get to the root of the traumatic issues. The study of trauma shows you can't knock sense into people by talking to them. Trauma is not an issue of cognition. It's an issue of disordered biological systems. Trauma can make you struggle with chronic hypervigilance, a heightened state of awareness, and an overactivation of the fight or flight response. In other words, your brain can be irrationally on constant alert. This is because the trauma impacts the unconscious, emotional, reptilian part of our brain, causing us to become chronically frightened and to interpret the world as dangerous. You know you shouldn't feel that way, but you do. And then that makes you feel even more defective and ashamed. You can't reason your way out of it. Talk therapy can be helpful for acknowledging what's happening and how it's affected you, but talking won't put it behind you. It simply doesn't go deep enough and affect the emotional reptilian part of the brain. Your body can actually hold on to trauma, and it isn't until you tap into the reptilian part of the brain with the following treatments and therapies that you might be able to permanently let it go and then move on with your life. And even if you don't think you've experienced anything too traumatic, you'll probably benefit from these steps. Neurofeedback is a type of biofeedback, and it shows your brain activity in real time and teaches you how to self-regulate it. Sensors are placed on your scalp to measure your brain's activity, and the measurements are displayed using video or sound. It works at a deep subconscious level, breaking the cycle of trauma and post-traumatic symptoms. It allows you to move past the traumatic events without actually having to talk about them and to relive them, and it shifts you into a neutral, healthy state of mind. Research shows that it works. Just last year, individuals with treatment-resistant post-traumatic stress disorder completed 40 sessions of neurofeedback, and the researchers found it significantly reduced their PTSD symptoms. In my 38 years of practice, I've never seen any treatment that comes close to producing the results that neurofeedback offers. I've seen results achieved in days and weeks that previously took months and years to achieve. Dr. Jack Woodward, MD, board-certified psychiatrist. In another study, victims of torture who had not responded to conventional treatment did 20 sessions of neurofeedback, and they demonstrated a substantial recovery. The researchers have also concluded neurofeedback is helpful in the shedding of substance dependencies that are common in treatment-resistant PTSD. The vagus nerve is the longest nerve in the body, and it's part of your parasympathetic rest and digest nervous system. Stimulating the vagus nerve allows you to more effectively respond to emotional trauma and to overcome it. Stimulating the vagus nerve can help you to overcome trauma and anxiety and PTSD without medication. Research shows vagus nerve stimulation can help to treat a number of treatment-resistant anxiety disorders. This includes patients with PTSD that haven't responded to medication. The vagus nerve stimulation has also been shown to enhance the extinction of conditioned fear, making it useful for severe anxiety and PTSD. The cure for the pain is the pain, Rummy. Neurofeedback lets you move past the traumatic events without actually having to talk about them and to relive them. But sometimes that isn't enough. Sometimes you have to relive the trauma to actually move past it. This is where eye movement desensitization and reprogramming comes in, or EMDR. EMDR is a fairly new, non-traditional type of psychotherapy, but it's growing in popularity, particularly for treating emotional trauma and post-traumatic stress disorder. During a session, the therapist will move their fingers back and forth in front of your face. You'll then follow the hand motions with your eyes, while thinking of the disturbing event from the past. As you do this, your brain will start to reprocess the traumatic memory until it no longer bothers you. It allows you to come to peaceful terms with previously disturbing events, and surprisingly, it leads to increased insight about yourself. According to Dr. Norman Dodge, the author of The Brain's Way of Healing, EMDR is the most promising treatment for trauma and PTSD. More than 30 controlled clinical trials have demonstrated the effectiveness of EMDR therapy for overcoming emotional trauma and PTSD. Several studies have found 84 to 100% of single trauma victims no longer have post-traumatic stress disorder after just 3 90-minute EMDR sessions. Other studies have found 77% of multiple trauma victims were no longer diagnosed with PTSD after only 6 sessions, and 77% of combat veterans were free of PTSD in 12 sessions. EMDR has also been shown to be effective in children who have experienced emotional trauma. As a result of this, researchers and multiple health organizations have concluded EMDR should be a first-line treatment for acute and chronic PTSD and must be considered before medication because it's been shown to be more effective than SSRI antidepressants. Although research continues to pile up in support of EMDR, it remains controversial among some healthcare professionals. This is likely because it doesn't rely on lifelong talk therapy or medication, and therefore puts a lot of people out of business. Loving kindness meditation, or Metta, is a practice designed to enhance feelings of kindness and compassion for yourself and others. It can help you to overcome trauma and PTSD without medication. You repeat positive phrases to yourself and direct well wishes towards other people. In one study, veterans with post-traumatic stress disorder practiced the loving kindness meditation for 12 weeks. At the end of the 12 weeks, the researchers reported increased levels of mindfulness and self-compassion in the veterans. And 3 months later, the veterans had reduced symptoms of trauma and depression because of their enhanced feelings of compassion. Another study found increased positive emotions and self-acceptance in the veterans who practiced the loving kindness meditation. Emotional freedom technique, or tapping, is a form of therapy based on ancient Chinese acupressure and modern psychology. The EFT can help you to overcome trauma and PTSD without medication. It involves tapping a series of acupressure points while thinking about a traumatic event and stating positive affirmations. It can lower your stress hormones. Research also shows it can help you to manage and overcome emotional trauma. Last year, research conducted a meta-analysis of all high-quality EFT studies and concluded 4 to 10 sessions of EFT can effectively treat post-traumatic stress disorder without side effects. They determined it's just as effective as EMDR and cognitive behavior therapy. Researchers have stated even though the approach has been controversial, there's no doubt EFT is unusually effective in its speed and power because deactivating signals are sent directly to the fear center of the brain. Tapping on the selected points during the process quickly and permanently reduces maladaptive fear response to traumatic memories and related cues. Several individual studies have also found it quickly and permanently reduces PTSD symptoms in military veterans, disaster survivors, and other traumatized individuals. With veterans, studies have found EFT significantly reduces their psychological distress, and 90% of the participants no longer scored positive for PTSD after just 6 treatment sessions. These improvements remained 1 year later. However, some hypnotists say the acupuncture points are not important, and the hypnotic operators of intention, distraction, and the routine or the procedure is what activates the healing power of the method. Resentment is like drinking poison and then hoping it will kill your enemies. Nelson Mandela. Research shows difficulty forgiving oneself and difficulty forgiving others is associated with increased symptoms of post-traumatic stress disorder. One study found when a victim of emotional trauma forgives the person at fault, there's a significant reduction in their PTSD symptoms. Forgiving one another can help us to overcome trauma and PTSD. Emotionally abused women that did forgiveness therapy experienced significantly greater improvements in their PTSD symptoms than the women who received an alternative treatment. If you've experienced emotional trauma, you need to focus on letting go. It's easier said than done, but luckily a lot of therapies above, particularly EMDR, can make it easier to forgive. When it comes to forgiveness, the human neurology needs to feel some sense of payback has been given to the perpetrator before you can move on. This may be coming to the realization that they did what they did because of their upbringing and they had no choice, and you were just in the wrong place at the wrong time. And karma or some other external force will ensure that they have to make some payback for their actions. If you can let this go and realize the best way to get your payback is to get on with your life, start living again, and let the universe or God or karma or whatever you believe in take care of them, this perspective change can help you to move on and heal. This can be done in hypnotic therapy. They have chair therapy, where you imagine the perpetrator sitting across from you and you talk to them. Or there's pillow therapy, where you imagine all your anger going into your hand and you have the perpetrator as the pillow and you punch your anger out into the pillow until it releases. This releases the stored tension in the body, restoring neuroplasticity to the brain, allowing for new learning. There's several forms of brain stimulation, but 2 stand out for the treatment of emotional trauma and post-traumatic stress disorder. The first is cranial electrotherapy stimulation, or CES. CES involves the application of a low-intensity microcurrent to the brain. This current stimulates the brain via electrodes placed on the earlobes, and it affects emotional regulation by influencing neurotransmission in the brain, including serotonin, norepinephrine, and melatonin, and these play a role in depression, anxiety, and sleep. It may sound dangerous, but it's very safe, and it's been widely used in Europe since the 50s, and in the US since the 60s. It's also been cleared by Health Canada and the US FDA for the treatment of depression, anxiety, addiction, and insomnia. Researchers found CES treatment 20 to 60 minutes per day, 3 to 5 days each week for 4 weeks, decreased the frequency of PTSD symptoms in veterans. Personally, I've used the SOTA biotuner for a decade and only noticed improvements in my memory, mood, focus, and processing of information, with no side effects. In an online survey of 145 veterans and military personnel, 60% of the individuals used CES to treat their PTSD, and the majority of participants reported at least a 50% reduction in their PTSD symptoms when using their CES device for at least 20 minutes once or twice a day. The results show individuals who are not taking any prescription medication rated the CES more effective than the veterans who are also taking medication. Unlike all other brain stimulation modalities, it's relatively inexpensive and you don't need to see a professional to take advantage of it. If you have difficulty falling asleep, are anxious or depressed, or have chronic pain, these symptoms respond well to CES. It also helps to reduce addictions as it balances neurotransmitter levels in the brain. The other form of brain stimulation that can help you to overcome emotional trauma and post-traumatic stress disorder is called transcranial magnetic stimulation, or TMS. It's a non-invasive procedure and it uses magnetic fields to stimulate nerve cells in the brain. Studies have found it can significantly reduce depression, anxiety, and PTSD symptoms, including hyperarousal, intrusive thoughts, vigilance, withdrawal, and emotional numbness. The effects are persistent and remain significant 3 months after the treatment. However, unlike CES, you can't do TMS at home. You need to find a practitioner who provides the service. Gratitude is a tendency to appreciate positive occurrences or being thankful for receiving certain benefits in your life. It can help you to overcome trauma and PTSD without medication. Studies have shown gratitude is associated with increased resilience to emotional trauma, and individuals with PTSD have significantly lower dispositional gratitude. But luckily, this can be changed through practice. Research shows over time daily gratitude promotes positive outcomes after trauma and reduces symptoms of PTSD. Try to write down 5 things that you're grateful for every day. They don't have to be big things. Anything will do. It can be as simple as being grateful for the apple that you're eating. If you do this every day, you'll start to gather a pretty big list of things you can look over whenever you're feeling ungrateful. Heart rate variability is the variation in the time intervals between your heartbeat. It's a reliable psychophysiological marker for the functioning of your nervous system and accurately reflects your ability to cope with stress. People with good heart rate variability tend to be more optimistic, take initiative, and are stress resistant. People with low heart rate variability tend to be depressed or anxious and have trouble learning. Several studies show higher heart rate variability is associated with less anxiety and fear, and individuals with post-traumatic stress disorder display lower levels of heart rate variability. Our results don't necessarily suggest that lower heart rate variability causes PTSD. Rather, it's a harbinger or a signal that the body's stress response system is not functioning optimally, and that might put the individual at a greater risk for developing PTSD once he or she is exposed to a trauma. Dr. R.P. Minasan, Ph.D. In one study, Marines whose heart rate variability was low before they were deployed were significantly more likely to be diagnosed with PTSD after the deployment. Luckily, you can increase your heart rate variability. Researchers have found heart rate variability biofeedback significantly reduces the symptoms of PTSD, improves cognition for those suffering from PTSD, and improves the efficacy of other therapies that treat emotional trauma. You can try to increase your heart rate variability using a device like the EM Wave 2 Biofeedback device. It's been shown to increase the heart rate variability coherence in combat veterans with PTSD. It's important to note when your heart rate variability is high, your vagal nerve tone is also high. They're correlated with each other. So stimulating the vagus nerve can also increase your heart rate variability. Curcumin is the most heavily researched compound within turmeric, the spice that gives curry its yellow colour. Curcumin is a natural compound in the turmeric, and it can help people to overcome trauma and PTSD without medication. It can lower your stress hormones, increase your brain's growth hormone, and strengthen the integrity of your blood-brain barrier. It might also be able to help to treat post-traumatic stress disorder. PTSD is characterized by unusually strong and persistently reactivated fear memories, and researchers have found curcumin impairs the reconsolidation of the fear memories in animals and concluded it can be used to treat PTSD. Magnesium is a vital mineral and it participates in more than 300 biochemical reactions in the body. This includes neurotransmitters, enzymes and hormonal activity, all of which have a huge effect on your mood and your brain function. It's one of the 3 nutrients that everyone should be taking for their brain, as most people are deficient. It can help you to overcome your addiction and withdrawal and support your brain's mitochondria. Studies reveal magnesium enhances this process so that events which previously caused an emotional response no longer trigger fear. Magnesium L-threonate helps the prefrontal region of the brain to block the return of old fear memories. It can also help you to overcome emotional trauma. Studies have found supplementing with magnesium threonate increases levels of the magnesium in the brain, and it enhances the extinction of conditioned fear responses to traumatic memories. The researchers concluded this might be used to enhance PTSD therapy. Foods that contain magnesium include spinach, chard, pumpkin seeds, almonds, avocado, dark chocolate, and bananas. Supplementation or taking Epsom salt baths is still necessary for most people because magnesium is rapidly used up during times of stress, and certain psychiatric drugs also deplete your magnesium. Melatonin is a hormone released by the pineal gland, a small gland in the brain. It helps to control your sleep and wake cycle or your circadian rhythm, and adequate levels of melatonin are necessary to fall asleep quickly and sleep deeply throughout the night. A disrupted circadian rhythm is linked to the development of post-traumatic stress disorder, and researchers have concluded supplementing with melatonin is a promising treatment strategy in the management of PTSD. Animal research has shown melatonin reduces PTSD-induced anxiety-like behaviors in rats. Other than supplementing with melatonin or taking a sleep supplement, there's some other actions you can take to naturally produce more melatonin and improve the quality of your sleep. You can expose your eyes to sun in the morning. Supplement with magnesium and collagen before bed. Lie on an acupressure mat for 10 minutes before bed. Turn off household lights, get red light bulbs, install Iris on your computer, and wear blue blocking glasses as soon as it gets dark outside. These glasses block out the blue light in your environment, and blue light suppresses your body's production of melatonin. Go to bed at the same time every night. Don't eat for 3 hours before bed. Completely black out the room with curtains and wear a sleep mask. When it comes to available research compounds, NSI-189 is being investigated due to its ability to increase neurogenesis in the hippocampus, the area of the brain that deals with emotions and memory, which tends to be shrunken in patients with PTSD. Preliminary research seems to imply it's capable of regrowing that area. This may restore the lost emotional range that can be experienced by PTSD patients, as this is part of the body's protection mechanism to protect them from the heightened emotional traumatic experiences. Anecdotal user reports on sites like Reddit seem to show it's successful for some people. However, at this time, it's only for research purposes, and the user takes all the physical and legal risks if they choose to experiment on themselves. Hypnotic regression also seems to be a good option for anyone with PTSD. To learn more, you can check out my videos on CBD, picamillan, lavender oil capsules, N-acetylcysteine for mental health, melatonin, magnesium, and more on my website. To book a consultation or learn about natural treatments, also check out my website.